Have you ever heard of a cranial remodeling orthosis? Let's dive into a little bit about what that is and what it's used for. You might have seen or heard babies have flat spots on their head sometimes. There are two common types that we see. One is plagiocephaly and the other is brachycephaly. Plagiocephaly is generally characterized by asymmetry, which means there might be a flat spot on one side of the head versus the other, which also comes with a forehead, eye, cheek, and ear shift as well on that same side. Brachycephaly, on the other hand, is characterized by a general central flatness on the back of the head, which can be often seen with the head is a little bit wider than it is long, and sometimes you can see a upward slope coming from the forehead up to the back of the head. If you notice your baby has a flat spot, don't worry, it doesn't necessarily mean that they need a helmet. We generally recommend that any head shape concerns be evaluated between 4 to 6 months of age. It's important that your baby be evaluated by an orthotist because they can determine the severity of the flatness as well as the proper treatment plan, because at some mild cases, conservative treatment may be appropriate, which is just increasing tummy time, doing different repositioning efforts, or maybe physical therapy instead of the helmet. A cranial remodeling orthosis, also commonly referred to as a helmet, can be used for infants 4 to 18 months of age. Generally, we recommend starting between 4 to 6 months if a helmet is needed, because at that time the baby's skull is soft and they're growing rapidly. As they approach 12 months of age or beyond, their growth begins to slow down, their skull begins to harden a little bit, and it's harder to capture more of that growth. The earlier we start, the more growth we can capture, the more effective helmet treatment will be. At your first evaluation, your orthotist will ask you a few questions about your baby, including their sleeping habits and the milestones that they've reached so far. They'll also look at your baby's neck range of motion to take some measurements, including things like circumference, the width to length, as well as diagonals of their head as well. This will help them determine what type of flatness your baby has, as well as the severity, and determine the appropriate treatment for you and your child. It's very common for a lot of babies to have some sort of degree of flatness on their head, but generally flat spots are caused by a prolonged pressure in one part of their head, which is usually due to the necessary safe sleeping habits and positions that are recommended, as well as position in the womb, commonly with twins, and torticollis, which is a condition where the neck muscle is a little bit tighter on one side, which restricts neck range of motion. How the helmet works, it is custom made to your baby's head shape. What it does is it touches the baby's head where they're a little bit longer, whether that be on the sides or maybe one of those two diagonals, and then it allows for extra space inside for the baby to grow into. So we're not squeezing and applying force to reshape the head that way. We're just applying carefully shaped void spaces as well as gentle touch to guide their growth into that open space. Babies typically wear this helmet for an average of 3 to 4 months, and they do wear it 23 hours a day. But we do work your way up to that, and your orthotist will help you ease into that transition with a gradual wearing schedule. Here at Empowered, we use the Sprout 3D helmet. It is a 3D printed helmet based on a 3D scan. So we use a white light scanner, which does not provide any flashing lights to the baby's eyes, but it takes a few cameras and the reflection of light to create a 3D image. That way we can align and accurately shape the helmet to your baby's head and provide an appropriate fit. This helmet is about 20% lighter than a lot of the general helmets on the market, and it allows us to create perforations for airflow and have a really nice fit at the first day. This helmet also has a living hinge on the side, so you just press the button and it opens up really nice and wide. That way it's really easy for parents and whoever's caring for the child to click it on and off. Once the baby has been 3D scanned, we generally have to fabricate and fit the patient within 14 days of the scan. This is to ensure that the baby's head shape doesn't change drastically and that the helmet fits appropriately. The first day that your baby is fit with the helmet, your orthotist will make sure that there's enough clearance for the eyes, ears, neck, and shoulders as well for them to properly move and see and hear. During this fitting process, the orthotist will make sure to go over everything that you need to know, including how to wear it, when to wear it, how to clean it, any things to look out for, and how to prepare you for that gradual break-in schedule to ease the transition from no helmet to 23 hours a day. Once you take the helmet home, we'll want to see you 1 week after that appointment, and then from then on 3 to 4 weeks after that to monitor progress and to address any adjustment concerns as the baby grows. Another main cause of flatness is wound positioning, including if you're having twins, as well as the torticollis and again the necessary sleep procedures that are recommended. A lot of parents can be concerned that the helmet might be uncomfortable or cause their child pain. It is custom made to your baby's head shape and fit appropriately and should not cause any pain. Adjusting to the helmet can be a process. Sometimes the baby can be a little bit fussy in the beginning, but your orthotist will help work you through that and give you tips and tricks on how to ease that transition. Most of the time, after a few days, the baby doesn't even know that they're wearing the helmet anymore. The helmet does not affect brain development. The baby can play, move, and interact with the world just as any other baby would while wearing the helmet. If you have any concerns about your baby's head shape, early evaluation is very important.